Looks like I'm live. Welcome to my channel, Burton THR, and welcome to 2026. I just came across an article. I thought I'd try streaming, try examining this. Fourth generation ceramic head fracture and total hip arthroplasty. Case report and literature review. So the abstract, and I will, of course, put the link in the description. First, let's check what do I sound like? Okay, sounds good. Arthroplasty today, so April last year, 2025. Ceramics are used in total hip arthroplasty due to inherent wettability and low wear rates, but fracture risk is a known complication. I had my right hip revised January 2010, and I remember being told what was a particular statistic, and I can't. It was what a fracture at that rate at that time was 1 in 10,000, I believe. And with being comforted with, you'll know if you're the one very, very quickly. And in this case, it's presented a case report, 69-year-old male, body mass index of 40 kilograms per m squared, who suffered a fracture. So where does it mention okay. In this article, it talked about him being heavy. But this is what caught my attention: 36 millimeter ceramic femoral head. I have a 36 millimeter ceramic femoral head. I also have a ceramic liner, so ceramic on ceramic hip. And this gentleman had a polyethylene liner, and his case occurred 2 years and 3 months after his primary surgery, after a 4-foot fall off a ladder. Why this is interesting to me is because last year, July, I had a crash on my bicycle, landed right on my hip replacement side, directly on my hip, my greater trochanter. Crazy swelling immediately, but I could immediately weight bear, and nothing, to my understanding, negative occurred. I did not pursue any medical testing. Maybe wasn't the smartest move. That was my choice. The patient underwent revision of his total hip arthroplasty with polyethylene liner from a head component without explanation. Okay. Again, just figuring this out. I don't expect a lot of, and that's okay. So continuing, let's see. Case history. 67-year-old male underwent lift primary total hip arthroplasty for severe hip arthrosclerosis. The patient had severe medical comorbidities, including obesity. Okay. We can read this. Wherever you're at, what am I? 40. I was 46 at the time of my crash last year. I'm 47 now, 46. My primary, no, maybe it's, do I say unique? I was 29 years old when I had my right hip resurfaced. That resurfacing, the acetabular component, was loose for approximately 20 months, and it was revised to a total hip replacement, sadly. So going from metal on metal to a ceramic on ceramic, with the extra bone removal and the addition of now a device with a stem into my femur. So the removal of the femoral head and neck. Goodness, that was something that took a long time to get. Can I even say I'm used to it? That's another conversation, but let's continue. So the patient comorbidities, so obesity, chronic obstructive pulmonary disease, history of deep vein thrombosis, DVT, hypertension, and Parkinson's disease. Okay, if something that is, whether able-bodied people or those that have any kind of joint replacement in the lower half, if this is something we got to really look after, somehow, some way, get our bodies in check, because if this is an issue, this is certainly not in our favor and making our conditions worse. Could all stand to be a little bit lighter, a little more fitter, or a lot. Everybody, we each have to take responsibility for this. Specifically, as I think I've tried to lay out in my other handful of videos, this idea of personal responsibility. I've been there myself. My body weight has fluctuated crazy since surgery started. I come from an athletic background, a soccer player, runner, cycling. I competed as a scrawny cyclist. I was 6'1", 100 and where was I? The 170s. Okay. So anyway, something we can get all that we have control over, even if our circumstances look uncontrollable, whether it's some kind of joint degradation or even leading to joint failure, whether natural or artificial. Okay. So we end up having a fall. Anything else I want to look at in this radio? I demonstrated ceramic head fracture with several fragments from the region. Okay, man. I don't know how, but I remember I crashed directly my greater trochanter. The fact that I could stand up, and this is last July, and I made a couple videos about this. He presented in an outside hospital emergency department that same day, low back pain, discharged, ... Left hip showing obvious deformity. Wonder what stem he's got. Looks familiar to me. It was not until the initial surgeon was contacted by the patient's primary care physician that the severity of the condition was recognized, prompting the patient's admission. Stop doing that. Surgical exposure. They revealed 2 large fragments of the ceramic femoral head. So at least it took a fall to crack the femoral head. 2 large fragments. And look, and this is after the removal. Again, delta ceramic, so the pink ceramic, and with the polyethylene, probably cross-linked polyethylene liner. Other the particles removed the liner, and as tabular cups were evaluated, the ethylene liner showed signs of damage from weight bearing with the exposed trunnion, because of course, what would have taken up the load bearing after the femoral head would have been the neck. Wow, what a scenario. Physical examination reveals, okay, at this time, no reports post-op. That's awesome. The patient was lost to follow-up initially after the post-operative time frame, but was seen more than 3 years later. I'm trying to think. I didn't have any surgeon contact from any of the difficulties with my hip. Mechanically, it was sound it's been sound since 2010, but I have had issues, soft tissue and so on, that have really, really affected quality of life, working life, and so on. However, mechanically, everything looks sound. That said, I avoided any contact with the surgeon. Let's see, I believe he has retired, and it wasn't until, I want to say, 2024, November 2024, I believe I had the first, so let's say almost 14 years of no contact with the surgeon. So nobody following my case for approximately 14 years, let's say. That might not be exact, but it's close enough, whether it was 13 or 14 years, because there may have been some contact. Anyway, of course, looking back, yes, that's not necessarily smart. There's no monitoring. But at the same time, my relationship fouled, and I had to walk away from. Discussion. So ceramic bearing fractures are known, but a rare complication. One of the first reported biologic delta ceramic femoral head fractures reported in the literature occurred in a 45-year-old female after a traumatic event. This case report adds to existing literature of ceramic head fractures as described in the table with the ceramic femoral head fracture 2 years post-op, reporting a detailed description, photographs, ... Okay. All right. Well, I was 46, and I'm grateful. I'm grateful because my fall occurred again after a period of time where I believed, I think it was 2022. I had an incident in December 2022 where I believed I cracked. I'm going to have to go back and revisit the dates because this is crazy. I thought I cracked my femoral head, or something had changed after, literally, it was just entering a door, turning, and the torque just from turning. I think I was carrying groceries, just coming inside my house, turning inside the door, crack. It was cold outside. I hate the cold because my hip aches. All right. Now, if I can examine my own. Because I do discuss this in a previous video. And I think on this channel, I've not touched this channel or added to it. But I believe, let's see, where is it? Maybe update March 2025. StreamYard. Move. How do I stop share screen? Share screen. How do I do this right? So with the irony of what I've got, so seven uploads, and the one with over 1,000 views. So that my hip update March 2025, because previously to that, where is it? 2 years ago, failed and revised. Okay, so this one. When did I upload this? So September 18th, 2023. Yeah, so December 2022, I believed I had cracked. I cracked my hip, and then that started the process of trying to get answers and specialist appointments, which eventually, after a long wait, I'm a Canadian, our system is, okay, it is certainly not free, but it means a long wait to see specialists. And finally reconnecting with the surgeon, and I was expecting that I would have to have revision surgery, or at least mentally and physically preparing for surgery. And thankfully, from the tests and then that appointment, it was determined at this time no second revision was needed. Thankfully, that was a huge relief. And then 6-7 months later, I had my crash. Now, the relief of that crash was that if I had cracked in some shape or form, whether it was one crack or two, or if something was loose, I would not have survived the crash that I had off my bicycle. So, the beauty of that. Anyway, just thought I'd try this out. I didn't make an attempt through YouTube. It did not go well, but it's deleted, so it's irrelevant. Moot point. Anyway, happy 2026, wherever you're at, and maybe the further I dig into the stuff, I just thought maybe I'll consistently start doing these. So anyway, thank you for your time. Thanks for checking this out. Until next time, bye for now.